Hey team, welcome to your weekly update. I have quite a few things for you. A save the date, some reminders, and some new items as well. Okay, so I'm going to go ahead and get started. Let's start with the save the date. We have a town hall meeting scheduled at this time, so please just save the date for that. On June 30th at 7 a.m., 3 p.m., and we'll also host this via Zoom and record, as this meeting will be mandatory for everyone to watch with 145 employees. It's very hard to reach everybody in the same day, especially with space. So our schedulers will do a real good job speaking to you guys and scheduling at appropriate times for you and actually placing it on the schedule for you in Humanities, so you won't forget, number one. But number two, to ensure everybody has an appropriate space to go and you all know when we're going. Okay. Next, I have a few reminders for you. Reminders. I want to remind everybody that we did move the break room. Yes, however, we did not have the means of creating the outside space for that break room at this time just yet. Nothing has been done out there. Nothing has been changed. So please keep the designated smoking area still currently outside of the old break room. So that's outside of the old break room, outside on that deck, and they have an appropriate dispensing area there as well. You'll notice that black container meant for cigarette butts to go into. Let's please keep all smoking there. Of course, you can smoke at your own car in the gravel parking lot if you choose, but please pick up any trash that you may have and dispose of it properly. Okay, so that's a reminder there. Next, we have professional appearance. Professional appearance, as in our handbook, as when you were all hired, was all discussed. This is required every single day by every employee, obviously. So, just as a quick friendly reminder, name tags have to be on. Some of you have, of course, your names embroidered. That makes things tons easy. So you'll get there, obviously, if you don't have that yet. But if nothing else, the name tag must be on. Please make sure your name tag's, in the proper position, not on the logo side, on the other side, and that it's horizontal and correct, looks good. If it doesn't, please see your manager and ask for an exchange or for it to be fixed. They can help with that. I do understand that the magnetic ones are hard, so I know that you need some attention there because pets in our field, they knock them around and stuff. So while I understand, please just stay on top of it. Make mention to your manager if you need a new one, if you need it fixed or whatever else, okay? It's very important. We want our clients to know you by name, and so they need a reference point sometimes. Usually people don't remember on the first time, but if they have a reference, look back at your shirt. It's a good reminder. Uniforms. They need to be in good shape, guys. They need to look good, not stained, not tattered, not holey, no scratches, tears, or stains and stuff like that, not bleached. Please make sure that that's there, okay? Bottoms are on team members to take care of for themselves since everybody's a different size and shape and such. Seal blue is the kind we need, the color we need, but otherwise the tops are for us. Now, we only provide so much in a year. However, if it's been longer than that time, see Miss Dawn, or actually we have a jot form for that on Humanity. Just make note of that. If you have any questions, though, you of course can see your manager or Miss Dawn about that. But other than that, as far as uniforms, again, no tears, no strings hanging from them, no discolorations and such like that, and wrinkle-free. Guys, most of you guys have brand new scrubs and such, but when you walk in and there's full of wrinkles, you just don't look like you're quite ready to go to work in a professional place. So, wrinkle-free, must do it, have to do it. Don't want to send anybody home to go get dressed again, right? That's not good. Let's not do that. No facial piercings, guys. Seriously, I can't repeat this enough. Your mask isn't going to hide it, and it's definitely not going to prevent a dog snatching that out of your nose. It can get stuck on something. It will hurt you. It is a huge safety risk in our field. Don't do it. It's a no-no. It's in our handbook. You signed it. Don't do it. No facial piercings. If we see it and we have to say something again, you'll be written up. It's too minor. Let's not do that. Okay? And again, food safety risk, we want you to be okay. We want you to be safe. Hair color, natural colors, guys. It doesn't have to be your natural color, but somebody's natural color. We all like to dye our hair. That's great. Look, I got grays. I like to dye my hair, but natural colors, okay? No blues, no purples, no greens, no gold, nothing crazy. And reason is not because we're a bunch of party poopers, but we are a professional place of work. You have to deliver sometimes very large bills to clients. We need our clients to take you seriously. We We need them to be able to focus on your beautiful face and your smile and listen to the words that are coming out of your mouth, because it's important and you're educating them. So it's very important. Let's get that done, okay? We have to talk about odors too, guys. So pleasant smells, but be careful. Too much is just as bad as not good, right? People are allergic and such to different smells. Keep it minor when it comes to perfumes and body sprays and things like that, please. We want you to smell nice, absolutely, that's a must, but keep it low-key. We don't need anything, again, distracting, okay? Because if somebody is sneezing their brains off because they're in a room with you and you've got way too much and you're choking them, again, it's distracting, right? Let's keep with the distracting method. Not distracting, that's what we want. So again, just please refrain from wearing anything on your person that could be offensive or distracting to you. So no crazy colored headbands, hair not right on top of the head where it's distracting from your face, normal, professional appearances. You all got it. I know you do. Okay. Pets having procedures and boarding at the resort. We've talked about this multiple times, but it's definitely sometimes an area I feel like we have to re-clarify, especially with new team members coming in. All dentistries will stay at the hospital for 24 hours, then be discharged to the resort. Okay? Any surgery that involves an incision, castration, spay, anything, right? Gastropexy, any of those things, will stay at the hospital for 48 hours for monitoring. Then we'll be transferred to the resort after that for the rest of the boarding stay. The fees will apply as a boarding stay after the procedure. So any nights required to stay that wouldn't normally be required to stay for that procedure, while they're just because they're boarding, they will have boarding charges rather than hospitalizations. Okay? All right. And then on a second note to that, overflow non-critical patients. So this is patients coming in for a procedure. This is patients coming in for drop-off visit, whatever it is. And they're not critical. Again, they don't need to be monitored per se. These are pets you would put in a dog ward because you don't necessarily need to monitor them in the moment. Just no food or water, right? Sometimes for those procedures. So let's just not tell people that they can't drop off their pets or drop off because we're full. Our hospital will become full. However, let's just not forget what's attached to this beautiful hospital that we have. A very large, big resort. Yes, we will become busier. This is true, but there's almost never a time that we don't have, now that daycare is gone anyway, in the playground, there's almost never a time that we don't have a kennel available, even up to 5 available. Even on the busiest day with pets coming out and coming in, there's generally at least a condo available. Even if it's a Y, that's okay. A Y is just as big as any hospital kennel, for sure. So, in this cases, nurses will take care of them. They will take them over to the resort with a cage card that would come from the hospital. Resort techs, you guys don't have to take care of these guys. They are under nursing care supervision until they come back over. There should be nothing necessarily needed by you. Of course, pass your eyes on the pet, make sure everything's okay. Absolutely, that's every pet in your care or in your facility area, okay? But otherwise, nurses will take them in, they'll bring them over there, they'll mark in SmartFlow and put where they are. So if you put them in orange 10, you mark, you put them in orange 10 and that they're at the resort so that everybody's very much aware of where this pet is. We will run out of room occasionally. We are going to be adding on, this is out with this whole build out process, we'll add more kennels to the hospital when we can. We'll get there. Okay, so again, no telling clients we cannot take them. No, we have room over at the resort almost always. So look there first. All right, we have some new things, and I left these things down for last because I want to be sure that you listen to me all the way to the end because it's important. Payroll software and paid time off accrual tracking will now happen in a new software. Why? Not that anyone probably knows that we even use a software now currently called BenefitMall, right? That's kind of a Beryl's wheelhouse, and she's in charge of it, and she rolls with it, and she's wonderful at it. You guys probably don't even know that we use BenefitMall for that, but we do. But BenefitMall is selling out and not going to be in business anymore. So we have no choice other than move on. So NVA has decided to go with a new software called ADP, also known as PETS. They call it PETS. This is called Payroll and Employee Tool System, is why they call it PETS. They decided to use this. They feel like it's the most beneficial to all practices, and it has the most closely linked items, kind of like BenefitMall. So not huge changes. Obviously, you're still going to get a paycheck, and it's going to be direct deposited, and all those things, right? So not a huge change for you. However, Beryl's job has definitely changed a ton, and HR and such like that a bit. And just the way we track things. So we like transparency. We like you to all know this, and it does come with some significant changes for you in the way of, they got some pretty cool things, like there's an app that you can actually download and take a look at your deductions at any point that you'd like. Take a look at your PTO, your pay time off accruals at any time. And the reason why I call it PTO, pay time off, is because we don't distinguish between sick time, vacation time, any of that kind of time. So it's just pay time off, right? So that's that. And like I said, it has the couple cool features to it. You can even add like a savings account or something like that to it if you like to save on the side in a different account versus your checking account that you have now. So some pretty cool things, I think. So I'll be putting up some table tents and some posters and things that have the information there that will allow you to just do a little barcode scan and download the app for yourself. We'd like everybody to do this. That way you're really in the know all the time about your deductions, pay time off, and there'll be more information for you there. Okay? But there are some differences in the way this software works. There's just not much we can do about it. So we did our best to get things very close to what we already had before. Difference being, currently you accrue paid time off on a bi-weekly basis, just kind of a flat rate. Just flat, no matter what. But you had 3 tiers. If you worked 34 hours or more, you were considered full-time paid time accrual. If you worked, I think it was like 28 to 34 or 30 to 34, it was kind of 2/3 time accrual, and then less than that was part-time accrual, or 1/3. Okay, so we had that broken down, and depending on which tier you fell, on average, you got this certain allotment per. Okay, and that was just bi-weekly, no matter what. That's what you got from your average hours worked over a course of 6 months. Now how it'll work will be very much more real time. So if you work 30 hours a week, every week, never changes, that's just what it is, you will now have full-time accrual. So the most accrual that you can possibly have, you will have it if you work 30 hours or more, but it is by the hour you work. So if you work 34 hours versus 30 hours, you'll get a little bit more. If you work 40 hours versus 30 hours, you get a little bit more. So if you work more, you earn more. Makes sense, right? So that's how that is. There is a part-time rate and there's a full-time rate. Again, 30 hours is the legal required amount to be required, considered as full-time. So that's just it. It just goes off the legal requirements there. And then what I did think was cool is we were able to allow for a little extra. So versus 30 to 40, that's it. We were actually able to allow a slightly larger accrual for those who work up to 45 hours. That being a way for us to ensure those who are putting in a lot of that extra effort and helping us when needed, because people get sick, people get hurt, whatever it is, maternity leaves, things like that, and we need a little extra help or support, or that extra surgery comes in and we're there late, somebody comes and helps and again gets a couple extra hours. It is another way to say thank you and to ensure that you get some time off. So you can accrue up to 45 hours worth. So I hope you guys enjoy that perk. Thought it was very much well earned and deserved. Okay, so there's kind of the cool changes there. If you have any additional questions, too hard to kind of list off a bunch of numbers, you'll get the information on a one-pager. We'll stick it into your locker. There will be a sign-off page, guys. We need this back quickly, so please review within the week's time and get that back to us. It'll be added to the handbook, of course, so that everybody's on the same page going forward. But if you have any other questions or concerns at all, please address these questions and concerns to Beryl or myself. I'd be happy to help you as best we can. Okay. Again, a little booklet, 1-pager, and a sign-off sheet will be placed in everybody's locker. Table tents and posters will be placed in all the break rooms so that you can have your app uploaded and get more one-on-one time with your paid time off, as well as your deductions and things like that going on with your pay. Good deal. Lastly, because if that one wasn't cool enough, this one might be cooler to some. We'll see. Mask update. As of this Monday coming, 5/31/21, masks will be optional as they are now for clients as well as team. Here's the kicker, guys. Keep that mask. We're not going to let it go probably for a very long time. Keep it around your neck. Keep it on your, I don't know, somewhere on your body, on your pocket. If a client walks in and they're wearing a mask, probably means they're more comfortable with a mask. Think of your elderly. Think of those with immunosuppressed issues. Be thoughtful. Please be courteous. So, the masks aren't going away completely. They're optional to wear, especially when you're outside of 6 feet range from other employees and such like that. But if somebody's wearing a mask, please wear a mask. So before they even reach you within 6 feet, if they're walking to you, mask goes on, okay? If you're walking up to them, you see they have a mask on, mask goes on. Just simple. It's not, we don't have to make it difficult. We don't have to ask on the phone. We don't need a glossary. If there is a mask on someone's face, be courteous and put yours on. This goes for resort employees, grooming, nursing, doctors, everybody. Management, everybody's the same, okay? Mask on a client, mask on your face, period, okay? Other than that, it's optional at this point forward, starting Monday, all right? All right, guys, I hope you have a wonderful week. I'll see you tomorrow.